Welcome to another edition of the Continuum podcast. I'm your host, Josh Wickman. It's great to be here with Natalie Handy, the CEO of CareForward, and we just kind of did a little spoiler there of kind of what CareForward is, and but we wanted to kind of get into a little further detail here. Natalie, would you be able to walk me through your background here? I know that you have 24 years in health and human services. That's obviously a long runway. What shaped how you think about care and community before CareForward came along? And again, I think you gave us a spoiler, but if you could just kind of expand on that.
Yeah. So my background, I'm a social worker by trade. I have been in the field now almost 26 years. So I'm dating myself even more. I'm a little bit older than that, Josh. So thank you for making me younger. But I've always worked with the foster care population. I've worked in mental health. I've worked with making sure that children had places to be. Children were meant to live in their homes. And so I've always been in some level of caregiver type role, but it was paid. And so what most people, it's not how CareForward started, but it really did start us off. My husband's a head and neck cancer survivor. And so in 2022, he was diagnosed with head and neck cancer. And that was really threw me into the caregiving role. And it was completely unexpected. I felt completely unprepared. And at the same time, we were also supporting our mom, and it was our mom that really is what led to CareForward. My mom was early onset Parkinson's, and she's 48 and diagnosed at 52, and that's when and my mom's young. She's only 71 still, and so she's had Parkinson's for well over 22, 23 years. But it was, so my sisters and I were caregivers at the same time for my husband. And then also for my mom, we were supporting our mom. Our dad passed away unexpectedly. And this is the story of so many caregivers. There's well over 63 million unpaid family caregivers in the United States. And that's important. The stats I'm telling you are important because it leaned into why we have CareForward. And these unpaid family caregivers really are the foundation of our healthcare system, because without them, we just simply would not have enough direct care staff that are paid. And so it was during this time that our mom was unable to remain in the community. Her Parkinson's had advanced so much. My younger sister quit her job and moved in with our mom after she had had 3 assisted living she'd had failed placements from assisted living facilities. They just weren't able to meet her needs, specifically her medication needs. And so when my sister moved in, that lasted 7 months, and that was tough because we thought, oh, we're going to be able to keep our mom in the community. She was at that time, 69. And because nobody thinks about being 69 going into skilled nursing. And so we did our best. And unfortunately, our mom's needs exceeded that of what we were able to do. And even more, what the community was able to give back to us. So think about my mom is a dual enrollee. She's Medicare and Medicaid. And so she has such high needs. We were not able to work with the government entities, the plan to really be able to maintain our mom in the community. And so as we were transitioning our mom to skilled nursing, JJ and I were sitting around in an apartment and it was actually a condo that we had rented because we had sold everything when my mom went into assisted living. Mm-hmm. And we were sitting around and we had all these things. We had all these items. And, you don't Tennessee is waste not, want not. You don't waste things, and especially in rural communities when money is hard to come by. And so we're sitting there and we're like, we have all these great things that we know people in East Tennessee need, and there was no way to get them to them. We couldn't sell it. We couldn't give it away. We were on Facebook and everything, and we couldn't donate it because there's certain items you actually can't donate. And so at that point, that's when we came up with the idea about CareForward. And, CareForward's a technology platform, so that listeners understand. We created a technology platform where individuals in need get connected with volunteers in the community And these volunteers and partner organizations contribute time, talent, or resources. So the idea behind it is that if you don't have a need met within 7 to 10 days, you could have a negative health outcome. And this is happening to people all over the time. And we're not talking about getting in to see your doctor. We're talking about what folks call social determinants of health. And these are the non-medical related items like having enough food, having transportation, having items so that you can remain healthy and well. And that's where we started CareForward. And it's just, it has really taken off. And the impact that we're seeing is amazing. The gratitude, not only from the recipients of these items or actions, but also from the volunteers that are like, this is amazing, this feels great, and they keep coming back to contribute again.
That really is amazing, Natalie. And I think that what makes it even more meaningful, obviously, is the fact that this something happened near and dear to your heart, to your mother, and the fact that and to your husband. So you've seen it kind of from both sides here.
Absolutely.
And the fact that you were able to make a negative into a positive, I think speaks very highly of you as well. And that CareForward kind of origin story is truly, I mean, incredible. So as far as like the industry trends, so thank you for that. The industry trends,
Yeah.
In healthcare, right? Especially Medicaid and value-based care. What major shifts are you seeing right now in how healthcare is thinking about social determinants, specifically related to your case? I mean, I know that's a loaded question, but
yeah, it's interesting because regardless of your political affiliation, I think we have to say, regardless of your political affiliation, the administration is the administration at the time, at any time. I can tell you when we created CareForward, we had a different administration in place. And so little did we know that CareForward was going to be so critically needed than 2-3 years later. Like, let's be really honest and transparent. We are seeing on the healthcare side from the administration, from the federal government, you are seeing cuts to programs that are safety nets, that are meant to keep people in the community, that are meant to help these individuals remain healthy and well. Because the goal, and this is the goal, I think this is important, like, spoiler alert, we need more well people. And the well people are who pay for the sick people. And when the sick people outnumber the well people, then the system completely breaks. And we as a community and a country cannot afford that. And so I think what we're seeing now is there's a lot of cuts under the premise of waste, fraud, and abuse. And I'm just going to call it for what it is. There's a lot of cuts to my nonprofit friends. I will share, CareForward is a for-profit, but we are a public benefit corporation. There was a reason we chose not to be a nonprofit, and I'm happy to answer that. But I mean, the reality is I want to focus on doing the services and getting them to people as opposed to fundraising. My nonprofit friends know the necessity that is fundraising. And there's pros and cons to being for-profit versus nonprofit. But for me, what we're seeing, regardless of your profit status, is that people are scared. They are worried about losing benefits. They are worried about like how they're going to pay for things. And when you have to decide whether I'm going to get my medicine or I'm going to pay my house or pay my electric bill or pay my water bill, then we've got a problem, because they're going to say, I have to keep the lights on and I won't get this medicine, but it's that medicine that is going to keep them healthy. And so all it is a ripple effect. And when you see hospitals closing, especially, the federal government passed in the big, beautiful bill last year, a lot of significant cuts. But on the other side of that, the solution was, we're going to give basically $50 billion to the states and say under rural health transformation, because so many services some of the cuts are impacting rural health. And we know that hospitals are closing in our rural communities. That's a
Hmm.
huge problem. And so I see on one side, we see a lot of cuts. On another side, we see respectfully some band-aids. And the people who are, the band-aids aren't small. It's a lot of money, but there's a
Hmm.
lot of strings attached to it.
Yeah.
So I think, from a standpoint of healthcare, we need to try to keep people well because that impacts ultimately cost of care and social determinants of health now, whether it's food banks that had money cut, states are having to decide how they are going to backfill monies that are no longer allocated.
Hmm. Now, and that's a great point. I mean, there's a lot of talk about, SDOH, and what does that stand for? I had to do my research, social determinants of health, and what is
Yes.
it? The non-medical conditions in which people are, born, grow, live, work. It's basically
Yes,
all the factors that determine health, and
that's right.
which account for the vast majority of overall health outcomes. Um, and so I think that you made the point: value isn't created when a need is documented, it's created when it's actually met. And so, do you feel like the industry, I mean, has caught up to that yet? I think I know but do you think the industry is at least trending in the right direction as far as catching up to that?
Yeah, I think it's yes and no. I think we're trying. I think as a system we're trying, and the problem is that we have a complicated system. We have
Mm-hmm.
a complicated healthcare
Yeah.
system in the United States, and you've got some entitlements versus, I like to call entitlements versus niceties, and so um, only 20% of our health is determined by the medical model. Okay. And so if you look, if you look at SDOH, and we're just using that acronym, the other term that they use for social determinants of health is health related social needs. Okay. That's the other term. So you'll hear those two used interchangeably. Um, but the reality is that we're trying to get there. We're
Mhm.
trying to get there. But our system is built on a medical model. Our system is built on CPT codes, and it is very client or individual member specific. And the problem is that we have the silver tsunami coming. If people may have heard, they're like, what is she talking about, the silver tsunami? It's when the baby boomers are retiring, and by 2030 we will have more people over the age of 65 in need of care than under the age of 18. We just simply will not. We're too heavy, and so we will not have enough care. And so if we do not provide the social determinants of health, and that those are the things that are all the soft things that need to be met that can't be met by the medical model, then we are going to have more people that are going to need congregate living or placements or a living situation where they need assistance from paid individuals. Because right now, the unpaid family caregivers are bearing the burden of caring for individuals. And but there is a little bit of light. There's a little bit of light. So, like for example, Medicare, I think it was either early last year or late in 2024, approved for family caregivers to be reimbursement for training for family caregivers. Mind you, that's only Medicaid or Medicare, excuse me.
Mhm.
Medicare is the only path to reimburse that, but is typically it will have a ripple effect or a trickle down effect of, can we get that reimbursement for training for those family caregivers under Medicaid? Can we get that under commercial insurance? Like, those are things that are going to be super important, because if the system is going to rely on family caregivers and other entities, then there has to be a reimbursement structure to allow those people to be appropriately trained so that these people live well.
Right, right, exactly. And I think the reimbursement system, is kind of across the continuum. And I've been in medical device sales for a dozen years, and so we have to work closely with, depending on the solution. But for example, I was with a urology company. We focused on kidney stones and bladder stones for the majority of it, but we did have an oncology kind of faction portfolio as well that
Mhm.
included prostate cancer care.
Hmm.
and there's basically a new care, a new ultrasound called HIFU, high intensity focused ultrasound, that instead of removing the prostate, right? Prostate cancer obviously is the most prevalent
Yes.
type of cancer, specifically among men in age 50 to 70. Obviously, that affects boomers. Now, and it will affect us one day. Hopefully, not me specifically, but yeah, I mean that it keeps going. But the point is that the whole reimbursement, the CPT process to get there, like it took so long when it was so obvious that instead of taking out the prostate, basically you're using a computer to ablate tissue and spare the rest of the healthy prostate tissue, which like to me, now granted, I mean, I've seen like, I can see through things. Like I've sold products that I'm like, maybe not. I've also sold products like these, which are like, wow, I mean, this is a game changer. And, the process that we went through to get that approved for private insurance, for Medicare, I mean, it takes years. And there's, people that are asking about it because they know someone who works for the company, or they know their friend who had it or whatever. So I've seen that firsthand as well. And, it just from that perspective, and, it can be a process. How do you see technology specifically form, platforms like yours, like
Yeah.
CareForward.io? How do you see the technology changing, what community care actually looks like on the ground, like on a bigger scale?
Yeah, and so I think that, and I can appreciate that we've currently been going through something similar and trying to get something approved for our mom. And, the delays in authorizations
Hmm.
sometimes are worse than the acceptance. And just trying to get it, and that will impact overall health and wellness. A lot of people, and this is so funny. I remember, so I'm old enough for all folks on here, I'm 50. And so I remember when I have been married more than once. So my ex-husband's mother or grandmother said, this was when technology, and this is 1999. And this was like, and she used to say, computers are the devil. And that was when it was all new. And we're like,
Hmm.
no, it's going to be great. And then we're all like, no, BlackBerry, they got us. And so anybody who's older and had a BlackBerry knows how they got you. But because you were checking emails all the time. But in this case, the challenge with technology is it is really great, and it can also be not great. Technology can also create isolation and loneliness, and people having this appearance, and it can actually disconnect us because how many, I've got 1,500, 2,000 connections, I think on Facebook, and I don't really like, that's not a relationship.
Hmm.
And so I think that's important to remember. And so technology can actually separate us, and what we want to advocate for, and I think what most people with tech want to do, is we want to bring people together in a healthy, positive way, which is what our platform does. It is really meant to connect people and connect resources, because if you think about it in the past, and think about health and human services especially, and if you add in the faith-based community, most people, let's use faith as an example. Somebody says, I have a need and it is this. And then a phone tree starts. This was before email. And then you get email. So maybe it's an email tree now, or it's a text stream, but you're always going back to the people that you always know. So what we always like to say is that in the faith community, for example, most of the time, 10% of the church are the active ones that are really responding to everything, but they're not reaching the other 90%. Well, how do we fully engage everybody? And that's what technology offers. We really look at our platform. While we are a technology company, we also have a person, a community development manager, that serves as the boots on the ground. So to also help with the relationship. So to me, I think this hybrid of technology and that interpersonal relationship is what's really going to be the difference maker, because not everybody will sign on. I
Hmm.
want to be respectful of people who have health, the literacy on being able to understand and how to use it. Some people are like, I don't want to get online, but I'll
Hmm.
help. And so, but how do we meet them where they're at, as opposed to I only do it through this technology or else? And I actually think there's ways that we can, by introducing technology to people that may not have access to it, that may not understand it, may not have maybe a literacy piece of it, that we are actually helping to inform them even more. And that would be our goal with the platform. But I think the relationship base is it's a hybrid for us that I think is important.
Yeah, no, absolutely. And I think just technology as a whole, from a basic standpoint, like you were saying, I really think in the future there's going to need to be classes taught on it,
Yes.
on the benefits and the downfalls of certain things, because, the next generation, I'm 35, and so I'm a millennial. I mean, the next two generations after me are going to have the bigger issue with it. Like I was just getting out of college or near the end of college when Instagram came about, and so, it wasn't that big of a deal, for me. But, you know, if if you can go down so many different rabbit holes on so many different apps that really you saying is, the technology for it's going to need to be reeled in at some point. And
Yeah.
now with AI too, and like I just, like I feel like I have a better relationship with you after a half hour than I do with 70% of my Facebook connections. Okay. Like, because that's not real. Like, what's real and what's not. Um, and I think that like reality and the internet is like, it's so separate, but it's like kind of converging together. And, again, I think that there needs to be like the benefits, and like I need to teach my son this one day. And, he's 18 months. So thank God we'll cross that bridge when it gets here. Right. But yeah, I think that, there's, but again, like to your perspective, Care Forward, I think that's a very positive use of technologies, connecting people who need care,
Yeah.
which is really important. And like, I think that that is a good excuse to maybe some people who aren't on the internet and are living real life, and good kudos to them. Right. But I think that they, um, this is a good way to go about it. So as far, Natalie, as your current state, right, with Care Forward,
Yeah.
what would you say is working really well for Care Forward right now, and what have you seen success with recently?
You know, for us, and we're in two pilots right now. We finished our beta in late last or early last year in 25, and then we kicked off two pilots with the state of Virginia. One is with local departments of social services, and so guys, the way this works is case managers or care coordinators put in requests on behalf of people. So it's not individual driven. It is actually case manager, care coordinator driven, because we need to vet the need. And so that works. Number one, how do you build trust in the platform? It starts with a vetted request for a need, because if people are going to give their time, talent, or resources, they need to know that this person is actually in need and it's not a scam. Okay. So that's a piece of it. And so there's ways that we, in our mind, that's the first test against verifying the need. And then the second piece of it is, for us, it's the end user's experience. And so if I'm a requester and I'm putting in a request, I'm going to tell you right now, the descriptions that are written we utilize AI. We've trained AI to be able to help with cleaning up language. And so that's a good way to use AI. You train it for what we're looking for. Our platform is completely HIPAA compliant, so there's never a worry about anybody's, a person's individual health information being released. Okay, so that's super important. But it helps the worker who, the requester who has probably a caseload, depending on if you're a DSS worker, you've got a caseload of 20 to 30 clients. If you are a care coordinator from a health plan, you have hundreds. And so every minute of your day matters. And so being able to have a system that is efficient, that they can fill out, they can complete a request in 5 minutes. That's that fast. And then we take it. That's the other piece. Now, the volunteer side, that experience needs to be simple. And so we have really made it so that folks like we come and pick up the item from you if you're donating, for example. That's why we have a community development manager. That's where the boots on the ground is so critical. If we just had a platform and there was no people involved, it would be no different than information and referral. And how would people be able to get the item to that person in a safe manner? And so that's why the CDMs are so important. And if you don't make it easy for folks, they will not do it. That, like, let's just really talk about it. If it's not easy for me to go to the grocery store, I am not driving across town when I can drive close by. I am not willing to do certain things, and my time is important. Post-pandemic, nonprofits and organizations who utilize volunteer, they will tell you volunteerism is significantly down. And I hate that. I hate that for the skilled nursing facilities where people used to come and visit those individuals. I hate that for nonprofits who need that. And so I think for me, for what's working well for us is our platform is easy to use for all users. That is critical. And then how we have utilized social media, we look to get about 30% of our volunteers solely from utilizing social media. And so we have, with our beta and our pilots, we've in a rural community. So this is a big, and we've done a lot of testing with this. We've probably easily had, we're probably at about 700,000 impressions. And so that's in a rural area. This is where people don't have access to the internet. It's not even, I don't want to use it. It's like, I don't have good internet. And so to have that many people who are seeing it, that is going to be important. So removing barriers to helping others is priority one. Good customer experience, priority one, easy to use.
Ease of use is the name of the game in 2026 for anything. So
yeah, keep it simple, stupid. That's my basketball coach said. Kiss it all.
Yeah, I like that. Yeah, because at the end of the day, time is everything. And when you're younger and people say that, it's like, well, I have a lot of time on my hands. I go to school and I have after school sports or whatever.
Yeah.
You don't realize it until you get into the workforce. Like, okay, actually, and then you become a parent, and then you get this, and then you're looking at new houses, and just everything, just life happens. Everything becomes, the stakes get higher, and then what is constant? Time. You still have the same amount of time, right? And I think that is really important too. And being able to get 700K impressions in Roanoke, Virginia, is a huge accomplishment. So congrats on that. I mean, that's amazing. So as far as, and that's great, as far as where things that may be maybe more challenging at the moment for you, would you say it's awareness, volunteer recruitment, partnerships, getting organizations to, route their needs through the platform? Like, is it a combination? What would you say is one of the bigger challenges for you?
I think I think the biggest challenge is not the need, and it's not use of the platform. I think it's making sure people see the request amongst all of the other noise. There's so much noise right now, and there's noise politically that consumes our honestly on our digital platform, on television, like anywhere you go, you see, and there's so much hard going on right now. And so I don't think it's that people don't want to give. I think it is that you can easily feel overwhelmed with what's going on around you and feel very helpless and hopeless and feel like, well, what am I going to be able to do? And that's where we come back with CareForward and say, you know what? Push the noise away. There's nothing we can do about X, Y, and Z issues that are currently streaming on every news channel and social media. What you can do is you can help this neighbor. You don't even know them, but you can improve their life. And this one person, to them, it is the world. And so I can tell you, we delivered a gently loved lawnmower yesterday. And the person, we had two other donors fall through. The two donors fell through, and I found a local one, and we drove it down and got it to this individual, and they were so grateful. And their yard is grown up. It is absolutely grown up. And he looked at us and said, I don't want you to judge me on the way that my home looks. He goes, this is going to be so helpful so that I can ensure I can get my mom in and out of the home safely. And I'm going to get it cleaned up. If you think about it, the fact that a lawnmower could help somebody's overall health and wellness, it's so simple. It seems so obvious, but in the noise, when you feel overwhelmed, it can be hard to see the forest for the trees. And so our messaging is help your neighbor, love your neighbor. Stranger. And so our motto, our motto, we like to say, strangers become neighbors, weaving kindness into the fabric of our communities. And here's the thing. My daughter is taking government, and we talked about the creation of the Constitution and all that stuff. And the beautiful part about this is it really is neighbors helping neighbors. That is what our country is built on. We are a good country. We are kind. We have kindness in us. And I think sometimes we see a lot of the negative stories. How do we get the kind stories out there that inspire people, which inspires more change?
Yeah, absolutely. And I think that's the type of story that, could go on your website. And I mean, I'm sure you have countless more of those as well. But I also think that, the media plays a huge role in that, in division, because at the end of the day, whether you're an R or a D, red or blue, liberal, conservative, I mean, a large percentage of the people want the same things. Okay. They want, they just want the economy to be affordable, and they want
they on these things.
They want the goods and services
to bad people. Everybody pay taxes, pay your fair share.
Yes.
But then, everybody do the thing.
Yes, exactly. Now, I mean, and I think the media is a big reason for the division. If you go on, I mean, X is my preferred app, for better or worse, probably. And I just you see the discourse on there, and it's just it's everyone is just trying to get gotcha moments at the other side, and it's this, and it's just turned into slop, and it doesn't help anyone. And division is the enemy, and I think that helping your neighbor is a good message as far as bringing everyone together, bringing the country together. Because I mean, we are. I think we're still the best country in the world, but we need to, there's a lot of things that we need to do, to move forward. And, and I think, I mean, listen, the economy is one of it. We can get into a long discussion about that, but I think that that's a great message as far as helping your neighbor. It's getting back to the basics, right? Of being simple. And I think that, it's also heightened when you live in a city like I do. And Chicago is, third or fourth biggest market in the country. And, I'm from Wisconsin, though. I'm from a suburb of Milwaukee, Wisconsin. So, I don't come from the big city. I've lived here for a dozen years with my wife, and, we want to move to the suburbs soon, and partially because of, all that stuff. We want a yard for the dog, and, simple stuff, not asking for too much. But as far as the growth for CareForward, Natalie, what would you say that looks like for you today? Are you more focused on expanding your volunteer base? Is it signing, payer or Medicaid partnerships, or is it getting more community organizations plugged in, or kind of all the above?
I think, it's D, all of the above. But what I'm going to tell you this is what I believe. I believe that we are doing the pilots to demonstrate to states and health plans. Those are your two primaries, to states and health plans, that this will not only pay for itself, it will impact our communities in so many positive ways. It extends access. It helps with member satisfaction. It impacts cost of care so that our limited resources can be stretched so much farther. And gosh darn it, people are just healthier. They have good clinical outcomes. People are not meant to live in congregate settings. Okay. They're not we are meant to live in community. And so if you need it, but those places are there. And so for me, I want for our local governments to see that every citizen in Virginia, but in the United States, I'm going to say this, in the world, this is a universal need of kindness, of helping one another, and that this will have a fiscal impact and that it's worth going. And so I don't think it should just be only Medicaid population gets access to this, only if you come through social services, or only if you come through the mental health board. I think every citizen deserves the opportunity. And I will tell you this, the beautiful part about it, a lot of people will be skeptical to say, well, are you sure they really need it? Or are you sure they're not just scamming the system? Because all we hear is waste, fraud, and abuse. Waste, fraud, and abuse is a very small percentage of what actually goes on. Let's just be really clear about that.
Right.
The people, I can tell you the impact that we've had. We have had contributions of over 500 actions or items. We have helped lots and lots and lots of families, but the fiscal impact on our community is at this point close to $10 million on just these handful of items of what we're able to deflect from high cost services. That is exactly why we should do it. If from a money standpoint, that's why we do it. For a compassion towards our neighbors, and because it's the right thing to do, and because, as our Constitution says, help each other, help citizens, we should do it that reason as well. And so I think about this, both things are allowed to be true. You can help your neighbor and it can be cost effective. What a novel idea. It's a good use of our taxpaying dollars. And I'm going to tell you, for me, I want my taxpaying dollars spent well on evidenced programs. This is something that has demonstrated that we have the ability to do that. And so stop putting into the pockets of a few, and how do we really help all Americans? And that's my goal for CareForward, is that this will be offered to all Americans, regardless of income, race, background, ethnicity, whatever you want to call it. Everybody deserves it. And as a caregiver, you never know when something bad is going to happen to your family member. And you can have all the money in the world. And, you look at like Bruce Willis and his wife. You can have all the money in the world, and that won't keep you from having a debilitating illness. And so how do you help? How do you help your neighbor? Because you don't know when you'll need it. Exactly.
And that's why you need to, everyone needs to live life to the fullest, and, and not take a day for granted. We all do it because we get caught up in all of our own lives. But that's a great way of putting it. It's a great message, Natalie. So I can absolutely appreciate that. And I think the listeners will as well. Now, as far as like the growth, back to that, what metrics would you say that you're focused on improving? I mean, you talked about the volunteer response rates, and, there's a lot of noise, right? When you're getting push notifications from, 30 to 50 different apps, it's like, it can get lost in the fold. So I think volunteer, response rates and like payer adoption, cost deflection data, like what metrics would you say that, you're looking at and focused on?
Well, I can tell you, number one, we have met 99% of all requests that were entered. That is unheard of. And so what I'm looking for is more volunteers. I'm looking for more volunteers, because the more volunteers I have, the more, because the need is there. The need is not a problem. It is having enough volunteers that everyone can contribute, because not everyone can contribute, but everyone can do something. And so it goes back to, I don't solely rely on social media to be the trigger point. In marketing, and this, it's going to take at least 3 touches. So you're going to see it via email. Are you going to get it through the notification? Are you going to get it via text? Because we're just adding SMS to our option so that people can see it. I know I prefer text over email every day, because things that are important to me, I will have my cell phone to text me. And that's optional. We're rolling that out in our platform. And then of course, social media feeds, and showing, hey, this is what the impact that you're having. So every time that we have, whether it's an individual or partner organization, as long as they give us consent, we post about the impact that they've had. We show the items, we show how this is your volunteer response, and it's one-time volunteer opportunities. It's not, you're not having to do long-term. And so for us, I think that's going to be the biggest thing. And so what I'm really looking at is, we're looking for more volunteers and partners. And there is no cost to volunteer. There's no expectations. And for our partners, we don't ask our partners for a dime. We don't ask, we just say, will you make your employees aware? We'll create all the materials for you to share with your people. Will you share it on your social media? Because this is crowdsourcing. This is crowdsourcing at its best. And our goal is to not ask for cash. That's the other thing I think that is really important, Josh, where people are so financially like worried right now. People are holding on to their money longer. But what you do have is look around what you have around your house. I don't know about you, but when my husband and I got married, we had 2 of everything. And so what are some things that you've been wanting to get rid of that are still gently loved, that are appropriate to give to someone else? We delivered a rainbow vacuum cleaner yesterday. Josh, are you old enough for rainbow vacuum cleaners?
I don't think so. I don't think so, but it sounds great.
People, this is when this was, there were rainbow vacuum cleaners. This is like the encyclopedias where they went from door to door selling encyclopedias. This vacuum cleaner has really tested time. Okay. This vacuum cleaner is at least 40 years old, still works perfectly fine. This older lady gave it to us and we had a request for a vacuum cleaner. And
that's amazing.
She was, and so it's perfectly fine. That's the best part about this. We're not necessarily always saying, give us cash, because I really want gently loved items. And what a novel idea. It keeps it out of it's environmentally sound. It keeps us out of the dump. It keeps us out the trash. And so how much could we repurpose?
Yeah. No, that's a really cool thing. And like, I mean, I can take a look around right now and I can see like 5 different things, right? So I think everyone can do that. Yeah, right. Like whether it's like something for like the built-ins, it's up there, or like we have 8 blankets right here that we don't need, that we use like 0 of. So I mean, it's it's a really cool thing. And it doesn't take much, right? Like, I'm not going to use that. Someone might actually really need a blanket out there, or I know they do.
I know they
right?
do.
Especially in Chicago, especially when it gets cold out, for people who might not have enough to make ends meet for the heating bill, like just even that concept, right? So that's, and it gets cold here, as you probably know.
It actually gets cold though in Virginia. We've had some cold streaks. We won't even talk about global warming, but it's not really fun. But it's either really hot or because I'm going to tell you, we had 4 seasons in Virginia one day earlier this year. It snowed, it rained, it hailed, it had some sun, and then it got warm. And I mean, it was everything in one day. And we're like, welcome to Virginia.
Yeah, no, that's amazing. And I mean, it's, it's a little different here, right? I mean, it sits in the 10s and 20s for weeks and you don't see the sun. And then I'm like, why do I live here? And then the summers are great, but they're short-lived. But no, that's great. And again, a great concept, a great message, and sounds like great execution as well. I think you have the 3 pillars. And where would you say you want CareForward to be in the next 6 to 12 months?
Oh gosh. 6 to 12 months. We've got our eyes. We're going to look to extend another pilot with the state because we're looking to deflect state hospitalizations and help with people maintain sobriety. So you got to remember, we do aging, disabled, chronic illness, complex illness, substance use disorder, and serious mental illness. Those are the health conditions that we help support. So pretty much everybody. I don't like to discriminate. And we're looking at more pilots. So we're super open to any other state. The best part about this, Josh, is that it is so replicable. Once we have a contract, we can turn around and stand up a CareForward area in under 90 days. And we start having immediate impact on the community within 120. So I'm going to tell you, we are actively looking for partners, whether it be state Medicaid programs, health plans, hospital systems. If you have case management or care coordination, we are looking to do even more pilots, or I mean, we don't even need a pilot. We know it works. So we're looking to get into states and really get this going, because I really think this is the future. This is loving your neighbor. This is community.
No, that's great. And yeah, I think Natalie, this has been a really meaningful, rich conversation. And I really appreciate you sharing the depth of what you're building and the thinking behind it, the experience that you have had that has led to it, all of it, right? It's not just your average venture, I would say, which is a great thing, and I think so. Yeah, I guess that's all I had for you. Once we compile everything from these conversations, and I'll see what the deal was with that recording situation, but I'll handle it. I can send over a summary, and I think you can find it valuable given the direction that the industry is heading around community-based care and SDOH fulfillment, something that I have educated myself on in the last 24 hours. And I feel that there's a big need around it because, there's a lot of things that you can't count on, um, the big companies for. You can't count, and that includes hospitals. You
Oh, of
can't,
course.
you can't count on, the government, right?
No,
It's got to be, you know, not B2B, but C2C, person
it
to
really
person, P
is.
to P. And so I think that that's a really important, part of it.
Yeah, no, it truly is, to be honest with you. And the C to C is that's really the impact
Hmm.
piece. Is
Yeah.
where we're just the platform is just the conduit. The
Hmm.
platform is just the place, and we're looking at it for not only social services or mental health, but it could be used in disaster response. Because we track all of these, we track deflections, we have track values, we track all this data, and we could use it as if you think about public safety with 911 calls for service, and how many times do the police and fire and EMS come out for inappropriate calls for service because people just are lonely, or
Hmm.
people don't have something, they don't have food, so they know the hospital always has food.
Yeah.
And so how do we, and then when the people who do need the services can't really get in quickly. And so we need to get those people out of the system and help them a different way so that those services that are really needed, that are super limited, that folks can access who really need it. And so I think we got something here. I'll tell you that. I feel blessed. It's innovation comes through pain in my mind. Comes through pain.
Yes.
It comes through
Absolutely.
pain.
Absolutely.